You are welcome to this episode of Talking with the Reproductive Medicine Specialist. We'll be considering dealing with IVF treatment cycle failure in this very episode. What happens when an IVF treatment cycle fails, and what is expected of the client and also expected of the reproductive medicine specialist. Dr. Debbie?
IVF treatment failure, it's something that happens. Some people succeed and some fail. Even worldwide success rate for IVF, even in European, the Americas, is between 30 to 33%. So definitely some people will fail. And this failure is usually a very traumatic event because, IVF entails a process that takes a lot from the woman, from the couple in general.
Yeah.
A lot of, physical activities going on, coming for your injections, having scans, going for some procedures in the theater. This takes a toll on the woman, disrupts her normal, life, activity and life. So definitely when it fails, it's a very emotional and traumatic event for the woman. But we want to say that the fact that IVF treatment has failed doesn't mean it won't succeed at another time. The woman shouldn't take it as her or the couple shouldn't take it that they have failed. They should know that it's the treatment that has failed. They shouldn't take it too personal. Definitely there's a period of grieving. Ruth, what do you have to say about this?
Yeah, so we know, okay, you've invested so much time, energy, and then money to this procedure, and then it turns out negative. Yeah, so there's a lot of grieving, crying, but then we will not encourage you to keep sulking in your grief. Yeah, just you need to find mental stability for you to pick up the pieces and then try again. The fact that IVF fails doesn't mean it will not succeed next time. As a matter of fact, there are a lot of people that have failed countless times, but there was always a time that they tried and they turned out positive. Yeah, so you need to, after you finish grieving, it's okay to cry. Yeah, it's okay to cry. And yes, we will always sympathize with you. But afterwards, you also try to pick up the pieces, whatever support that you need to be able to get out of this grieving process. Both your partner, if your partner is not so supportive, you can also speak with your doctor or your friends probably that have gone through this procedure that can encourage you, so you can find solace in them and then get your mental stability back.
You see some women at this time pushing people away, the support is there, even from their partners, but they want to push people away. This is not a time for pushing people away.
You need
get all the support you can get. You need to heal.
You talked about the patient, the client grieving. How about the doctors grieving?
Yes, the doctors grieve too.
The doctors grieve.
Exactly, yes, because it's our happiness when you succeed. So it turns out the other way when you don't succeed.
Also, invested time and effort and energy into this procedure succeeding. So when it fails, both the client and the doctor grieves. But sometimes the patients don't understand that you grieve as the doctor. Yes, they want to play a blame game and try to.
That's an aspect that's very interesting to me. Most times something that stands out so significant is the blaming game thing that goes on with the failure of an IVF treatment cycle. You have a good number of clients feel that the doctor didn't do what he needs to do. He didn't tell them the things he needs to tell them. He didn't give them the right medications. Occasionally they compare their medications with some other clients. And never knowing that these treatment cycles are individualized. And you could be going through an IVF treatment cycle in a number, but then every person's treatment may be slightly different from the other based on the need of the moment. And so they just feel that the doctor had done something wrong or the reproductive specialists have actually done something wrong. But what should be done? Just as you said, after taking some time to grieve or to mourn the loss, which also involve the doctors mourning, the client's mourning or grieving the failure of the treatment cycle, there are some scientific things that should be done. Yes, and I think this will be a time that the client should come back to the hospital and meet with the group or the team of specialists, and then the treatment cycle is is looked into again and probably look at what needs to be done or what probably went wrong, not necessarily wrong in the form of doing something wrong. It may be the garment not really being in the right in the best of conditions, maybe the sperms or the eggs and all of that be considered so that these people could have a very good counsel, or information about what probably may have transpired, even though often it is genetic abnormality that cause failure, and this aspect may not explicitly be explained to the patient because not all centers do genetic studies in an IVF treatment cycle.
Yes, that's so true. Yes, that's so true. The counseling is really very important. The clients shouldn't go and stay at home, playing the blame game or skip morning. You need to come back to your specialist so that the treatment can be evaluated. The various aspects of the treatment is looked at to see where the possible source of failure could be from. And like you mentioned, sometimes we can't really readily say this is the possible source of failure because, like you said, a lot of them are due to things involving the genes, the DNA of the gametes that were used. And except genetic testing is done, this might not come to the front, but we can, allow and say, oh, we think this might be the possible, source of failure, so that when another attempt is made, things can be done to, try to correct those aspects so that we can expect, a positive outcome this time around. Yes.
So for likely things that could cause failure, for instance, for someone that's maybe preparing for IVF, has a low ovarian reserve, poor ovarian reserve, and then she knows, okay, that her eggs might not be in excellent condition actually to carry out the IVF treatment, we could procure the option of using a donor egg, or she could decide to go for ovarian rejuvenation to help build up the quality of the eggs, even though that's not an 100% guarantee that it's going to give us the best of eggs, but it's also an option if she's not willing to opt for the donor egg. For someone that the sperm is the problem, we know we can also recommend testicular rejuvenation. They could also as well go for sperm donor option too, if they're also interested.
Depending on the level of the abnormalities, we could even be giving some medication supplements that could boost the sperm. So that can be done as a pre-treatment before the IVF process itself. Yes. And then even factors with the endometrium could also lead to IVF failure. When you have adhesions, you have abnormal masses, polyps in the endometrium, that will prevent implantation. So for such women, we recommend that they have a hysteroscopy to look at this lining so that to make sure it's healthy. And if there are abnormalities, this can be attended to before another IVF procedure attempt is made.
They can as well even do endometrial rejuvenation. They can also get intralipid medications. All that helps to enrich the endometrium and make it receptible to get the embryo. Exactly.
Yes. So occasionally, I'm actually particularly interested with the hysteroscopy. Hysteroscopy, it's something that we're currently evaluating for possibility of inclusion among the necessary or compulsory investigation that should be done before an IVF treatment cycle. You have a lot of gynecologists doing hysteroscopy, but not all these gynecologists have a very detailed knowledge of the health of the endometrium. Occasionally, the endometrium may even look normal, but then you have to take a biopsy of the endometrium and send to the pathologist to analyze whether there is an abnormality in the phase of the endometrial gland, or endometrial tissue during the IVF treatment cycle. The size of endometrium is actually quite large, and then it should actually be considered a lot following failure, even when the endometrium looks normal.
And even for someone that has recurrent miscarriage, they can also want to go for maybe after the IVF treatment, before the transfer, they might also want to go for pregenital diagnosis or screening, just to check that there is no issue on any genetic condition that could result to miscarriage or a failure of the IVF treatment. So they could assess, they could do a biopsy of the embryo before transfer about day 3, assess it, and then by day 5, they put the best of the embryos that are not affected to also hope for a positive outcome. And then even for sometimes when you have recurrent failure, for people that will be okay with it, they can also opt for surrogacy. That's another way to also get your children. Yeah, so that's also another option. It just depends on individual preferences. Yes, exactly. It just depends on what your peculiarities are regarding the IVF treatment.
So in a nutshell, when there is a failure of an IVF treatment cycle, it's good to take time to grieve to grieve and mourn the loss of failure of the IVF treatment. But after that, another visit should be made to the team of doctors, where the treatment totally is looked into, and the possible causes of failure may be discussed, and the option of another treatment going forward will also be discussed and given to the client. And usually, it's good to note that IVF offers no guarantee. It is just one of the last resorts, but still there's no guarantee that a treatment attempt may just turn out successful. You may have to do it once or twice. Tries. Some people have done up to 4 or 5 times.
Literature says the more you attempt, the more the chances of success increases.
And then
I think the watchword is don't give up.
Yes, that's it.
Just don't give up.
And then people should also think of accepting the option of using donor gametes when it's necessary, so that we don't go over the cycle of failure over and over again. Because sometimes the client also may just be responsible for the failure because of the option, the alternative of treatment that they accept or that is only acceptable to them. If you're advanced in age and you insist on using your eggs for IVF treatment cycle, chances are that you may not succeed so easily or quick. And if the sperms are very terrible, with all the abnormalities embedded in the sperms, success may also not be achieved so easily. And so those are some of the things that will be evaluated. So we're going to stop this show at this point. We look forward to getting comments from you, and we hope to see you in our next episodes. Thank you so much for watching.